Erections and beyond. For most men, getting an erection is an important physical trait. We value it. We prefer to maintain it throughout the span of life. I'm going to reflect upon care, maintenance, and revitalization of erections, but perhaps more importantly, male sexuality in general. So starting from the dawn of our awareness, when we become, through puberty, aware of our own sexual energy, testosterone surges are accompanied with libido and with erections, spontaneous morning erections, waking up with a morning discharge. These are common introductions. Our formative experience in sexual awareness can mold us for the rest of our lives. This speaks to the elements of sexual vitality. We all, human beings, we're sexual animals. That we have a sexual drive, that we have the capacity for physical intimacy is intrinsically human. What we choose to do with it becomes our prerogative. My objective is to help men maintain their good mental, physical, and sexual health. So typically, early on, erectile function is pretty spontaneous. The issues tend to be too vigorous, early ejaculatory effect. In some cases, however, there can be performance anxiety that initiates at a young age. A young man encountering a sexual opportunity accompanied with overwhelming anxiety will have difficulty achieving an erection. The fight or flight response prevents erectile activity. In order to get a good, healthy erection, you have to be in a place of relative safety, security, and calmness. You cannot run from the saber-toothed tiger and have an erection at the same time. Now, if that translates into a lot of psychological overlay, these type of performance anxiety issues can become manifest. We'll reflect upon that, how to overcome it. But it's helpful to know that that's a factor, that the anxiety and fear factor is there. I've seen that happen more in thoughtful, intellectual men than in people less so endowed. It helps to not think about it so much, right? So if you have to think about whether or not you're going to get an erection, you're likely not going to get one. Which puts us in that position as men, very performance-oriented. We can do ourselves and our partners a favor by de-stressing the performance aspect of it. We'll get to that in a moment. But in the interim, maintaining good erectile and sexual health. It helps to know thyself. So for sexual activity to be effective and successful, there has to be the right stimulus. A little bit different for everybody. It's not always obvious. That which men should be attracted to may not necessarily be that which attracts. And it can be hard to engineer that. Some of this is innate. A lot of it is innate. I once had a gentleman in the practice who was not in a relationship because he was so embarrassed at what stimulated him. It happened to be shoes. So that was his arousal moment. There's nothing really wrong with that. It's a little bit uncommon. The problem was his fear and his self-loathing that inhibited him from sharing it. I'm sure out there somewhere there's, shoe people. They've got to match up. So one issue, making sure that you're reflective, making sure that you're confident if you're having sex with a partner. I mean, if you're dancing by yourself, then the fantasy world is yours to display. With a partner, though, there's got to be a level of communication that can be hard to achieve. So some tips on that. You never do it or try to avoid doing it in the bedroom right after having sex. It feels like a review. Gee, that went well. It didn't go well. Be careful. Better outside. And sometimes it's better communicated like with an email. Hey, have you ever thought about blank? Dear wife, I have found shoes to be a little exciting. What do you think? I mean, if she slaps it down, so be it. The idea here is to be honest with yourself and that which stimulates, right? Men are visual animals. We usually get visually stimulated. So the environment, stimulus, that's got to be there. The physical environment. There's got to be privacy, confidence, security. If you have children in the house, they are a major buzzkill. You know what I'm talking about? White noise and locks are critical. On the other hand, you want to be well rested. As we get older, you go from 20 to 30 to 40 to 50. Sexual activity requires preparation. You can no longer roll over at 9 o'clock at night and just spontaneously, in many cases, be at your best. So being well rested, avoidance of overlaying stressors. You just crammed in a 13-hour workday. For some of you, and this is particularly true as men go, I'd say, past 40, 50, you're just not going to be all there. And that's totally cool. Some men, we have this gender bias that we always need to be ready to go, right? It's our job to be like the Jack in the Box. Bang, we're ready. Not quite the case. Men have a circadian rhythm, not too dissimilar from that of women. Sometimes you're just not in the mood. So that's okay. The environment matters. Physical preparation matters. Alcohol, be careful. Hey, when you're 20, it can be a stimulant disinhibiting. When you're 50, it can amplify desire and minimize performance. You go much beyond 1 ounce of alcohol, and you're going to have a negative consequence to erectile function in general. Taking a step back, in order to have a healthy erection, you need some key elements. We've described some of them. The right stimulus, the right environment, the right preparation. How about blood flow? Difficulty with erections is a yield sign for cardiovascular health. You should get a thorough evaluation. I like calcium scores in men and women over 50. A CAT scan of the heart, it can show you whether or not there's calcium buildup on the artery. That can help guide you toward global vascular health. Will exercise help? Absolutely. Cardiovascular conditioning, remember, men, your penis is an end organ. It's vulnerable to blood flow issues. So stay fit, stay healthy, get your cardiac evaluation performed. How about testosterone? Absolutely. I don't care what else is going on. If you don't have the right amount of testosterone, you're not going to get good erections. You must have that as one of the key ingredients, right? Cardiovascular health, physical preparation, the right stimulus, and yes, the right amount of testosterone. And it's not a blood level. There's not a cutoff that defines where testosterone should be. In my practice at Intellectual Medicine, we do primary care anti-aging. I'm of the opinion that every man and every woman needs to replace their hormones or they'll suffer negative consequence. The age at which that needs to occur is when symptoms manifest, and erectile difficulty and decreased libido are two primary symptoms in men. You have to get that evaluated. So what interferes with testosterone production? Heavy metals can interfere with the pituitary gland. They're worthy of evaluating. A history of head trauma, concussions, of course, testicular trauma. These can be variables. Getting a blood level of testosterone is reasonable, but using that as a criteria to make a decision regarding whether or not testosterone should be administered is a little bit narrow in scope. So my threshold is this. Do the symptoms align? Have we evaluated other potential contributing causes? In addition to looking at the hormones such as testosterone, estrogen, progesterone, we must also evaluate the thyroid, make sure that's healthy. Evaluate the heart, make sure the blood flow is good. Check blood sugar, diabetics are more at risk. All those things check off, and libido and erection still aren't quite where they should be. Now we go to testosterone. Although we can gauge your level today, we can't tell what it was when you were in your physical and sexual prime, and that's somewhere around age 30. The philosophy of anti-aging primary care is not to simply put you in the range of people normal for your age, right? It's to have you at your prime. Look, I don't want the hormone level of a man my age. I want the hormone level of Dr. Petteruti when he was 30. Why not? It's a better place to live. All right, so now you're contemplating testosterone, and remember, do this with somebody who has expertise and experience. Testosterone therapy can have some negative side effects. It can cause testicular atrophy. You want to make sure that you're engaged in a treatment pathway that'll last for life. Testosterone is good. We've got blood flow assessed. Now, what are the treatments? Testosterone replacement alone frequently does not quite address tumescence issues, erectile issues. The classic PDE5 drugs, Viagra, Cialis, sildenafil, that's Viagra, or Tadalafil, that's Cialis. These drugs are fantastic. There's absolutely no reason to deprive yourself of their benefit. Everyday use of Tadalafil has correlated with diminished risk of heart attack, stroke, and dementia. This is new information in the literature. I was at the andrology conference about 6 months ago with my colleagues from around the world. We're all talking about testosterone. I could tell you all the docs at the conference are taking Tadalafil every day, 5 milligrams every day, regardless. Better erections, decreased heart attack risk, decreased stroke risk, decreased dementia risk. Oh, by the way, helps with urinary flow. I mean, come on, guys, what's not to like? Oh, and it's inexpensive. Now, if it helps you with erections, that's pretty awesome. If it's not quite getting you to the top of the mountain, many of my patients will combine it with sildenafil. They'll take 5 milligrams Tadalafil every morning, and on game day, they'll take sildenafil on an empty stomach 2 hours before kickoff. Timing is important. What happens if the opportunity passes and you didn't have sex? So you wasted a couple of bucks, no harm done. Side effects can occur. They're pretty uncommon. Headache, nasal congestion. In some cases, it can lower blood pressure, especially if you're on drugs for blood pressure. So this is something you want to work with your doc. I support getting a good primary care doc to be your advocate. You could do this online, but why would you? It's simple. Talk to your doc. So we've got these elements. You got the medications. That's very cool. They're in place. Awesome. Here's a problem, though, with the PDE5 drugs. You've got to have foreplay to get an erection. There's got to be stimulus first. Suppose you're the guy with performance anxiety. You take your Tadalafil. You take your sildenafil. You're ready for action. You've rested. You haven't had too much alcohol. And you're about to engage your partner and you're thinking, I hope I get an erection. You're out of luck. It's like going to the plate saying, man, I hope I get a hit. There's got to be a release of neurologic overlay. So in some cases, injectable agents can be a great adjunct to overcome performance anxiety. What are those? There's a drug called Caverjet, prescription agent, Alprostadil. Think of it like Viagra injected into the base of the penis. I know, guys, it sounds hideous, but I've had many patients use this approach with great success. And once they get over the mental anguish of the concept, the needle is tiny, barely feel it. The Alprostadil or Caverjet is a branded drug. More commonly, I use my compounding pharmacist to make an agent called Trimix. It's a blend of 3 different vasodilators. The benefit to this is when you do the injection, within 5 to 10 minutes, you start to feel engorgement happening. So as you begin foreplay, you're already relieved of the presence or absence of erectile activity, since it starts before psychological stimulation occurs. You have to be cautious if you use this in combination with Tadalafil. You want to make sure that you're working with your doc. This can be a helpful agent. It can be used 2 up to 3 times in a week. Avoid using it back to back. It's pretty inexpensive. It works very reliably. It's a nice agent to have on board. How about other things that can be of some help? L-citrulline is a supplement that helps produce nitric oxide, which is a vasodilator. Taking this as an adjunct can be supportive. of vasodilatation. It can be an acid. Sometimes some people consider citrulline to be kind of a nature's Viagra. Other things that may be of help. Oxytocin is a hormone that stimulates sense of good feelings. It's a hormone that gets released when there is empathic touch. They do make this as a compounded product. I've not found it to be that helpful. Some people promote it to help achieve climax, to enhance the orgasm. Results have been very disappointing, so I've moved away from that. Another thing worth considering, and this will require a doctor skilled in more functional attributes, peptide therapy. There are two that are valuable in assisting with sex drive and erections. They are non-hormonal. They work on the part of the brain where the sex drive and libido live. One of them is PT141. The other one is melanotan. Both of these agents are injectable. They do have a nasally inhaled variety. It just doesn't work that well. If you're going to bother with it, I encourage the injectable form. Much more effective. Melanotan is fascinating. It's a peptide that was originally engineered to try to prevent skin cancer. It stimulates release of pigment from the melanocytes, so it gives you a tan without sun exposure, a little darkening of the skin. It also stimulates a part of the brain that enhances sexual desire or libido. If libido is an issue, this can be an asset. It also supports better erectile function and climax. It also has some benefit regarding weight reduction. Despite all those positive attributes, it is not an FDA-approved drug. We don't know if it has any value regarding skin cancer, either plus or negative. Those type of studies are hard to do, nearly impossible, so this agent never made it through an FDA process. It is available from compounding pharmacies with doctors who are skilled in its use and its prescription. So you can buy this, you can buy anything on the web. I advise you to work with a clinician who has skill in this field. They're typically primary care doctors like me that have done advanced training in functional and anti-aging therapies. All right, so now we've talked a lot about maintaining a healthy erection. Let's talk about maturity in sexual dynamics. Guys, sex can happen with or without an erection. If the erection is never quite to the level that you feel confident with, you can still have a very intimate, meaningful, orgasmic encounter with your partner. You got hands, you got a mouth. You got to be a little creative. The majority of women, I've done thousands of sexual histories in my practice as well as keeping up with the literature. Penetration is not the creme de la creme for the majority of women. It is clitoral stimulation, properly administered. This is something you can acquire skill at if you apply some thought to it and you apply some research to it. Clitoral stimulation with your hand, with your tongue, either, both, they can be very enticing to your partner. Well, how about you? Men can achieve an orgasm without a full erection. They can't necessarily penetrate if the erection is not rigid enough. But I've had patients in my practice do what I call parallel orgasmic activity, non-penetrating, stimulating a woman's clitoris while stimulating a man's penis, either with self-stimulation or partner stimulation. Self-stimulation tends to work better, less self-consciousness. The objective of sexual encounters in a committed relationship is bonding, right? It's a sense of intimacy, closeness. So stay connected. Don't let difficulty with erection be a barrier to sustain physical intimacy. It is a correlation of positive relationship. Sexual activity correlates with happier relationships by and large, and the range is quite variable. If you're having sex every day, well, good for you if it floats your boat. That's uncommon. There's nothing wrong with it. But if you're having sex once a week, do not feel that it somehow is below the mark and that you should do it more often in order to be happy. That's false. There is a cutoff. In my experience, in my research, roughly once a week is a good minimal threshold. If you're drifting below that, if you're once or twice a month, you're at risk of physically uncoupling. I encourage proactivity, which gets me to perhaps my last point. That is the different types of libido. There is spontaneous libido, and then there is reactive libido. When you're young, guys, you can remember high school, right? That girl with the tight sweater, whatever it was that attracted you, the bell rings and now you got to stand up. That could be a challenge. That's spontaneous. It's the type of libido that happens when you're just in the middle of your workday and the thought comes in your brain. That type of libido declines even in the face of optimal anti-aging support over time. It tends to be replaced by responsive libido, which is libido that becomes amplified and instigated by foreplay or the expectation thereof. So I strongly encourage mature patients in my practice, especially when you're busy, especially when your life is dense. Maybe you have people around you, maybe children around you, or you're just both working really hard. Set aside a premeditated time, if you will, a sex date, so that you are prepared mentally without the pressure of any predetermined performance element. This enables you to take advantage of reactive libido versus spontaneous libido. Sex for life? Yeah, why not? Intimacy for life? Yeah, why not? Why not stay vital? Why not stay young? Why not implement the things that'll keep you human, keep you energized, keep you active, and avoid things that damage your sexual well-being? Those things include anything that mucks up your hormone levels. We've been talking a lot about prostate cancer, about the ghastly, horrible approach of castrating men. Never do that. Certain drugs to be avoided. Some blood pressure drugs can be a barrier. Antidepressants and antipsychotics are notorious for mucking up sex drive and erections. So if those drugs are part of your treatment, have a conversation with whoever is prescribing it. Let them know your goals and objectives. And ultimately, the trimix can overcome even those barriers. So I hope this has been helpful. I like men in my practice to stay vital, stay energized. Same thing for the women. It's oftentimes a partnership endeavor, whomever your partner may be, right? Communicate, express honestly desires, and then dedicate time, right? It's very true. For things that are important, we make time. Don't expect this to, I like that, I think it's silly. The old Cialis commercial, the elderly couple, older couple, they're out antique shopping and they look at each other and they get that antique shopping. It's goofy. And then they're both sitting in separate bathtubs. What's that all about? That's not conducive. Anyhow, have fun out there, team. I hope these ideas have inspired you a little bit, and perhaps you could pick up that conversation with your doc. All the things that I mentioned are out there for you to discover and explore. Thanks for being part of this podcast.